Well, good morning and welcome to today's legislative listening session. Since this is a Zoom meeting, we ask that you keep yourselves muted until it's your turn on the agenda to speak. We do encourage questions, and you can type your questions by clicking the chat box in the lower part of your meeting window. This meeting is also being recorded, and a link will be provided to you within 2 business days. Thank you again for joining us today, and I'd like to welcome Melanie.
Thank you, Mitch. Thanks for putting this together. And welcome to all of you. Thank you so much for taking time out of the middle of your day to meet with us. We are doing 8 of these regional calls. This is our number 7, so we have 1 more tomorrow. And for those of you who don't know me, I'm Melanie McAleenan. I'm the Director of Government Relations and General Counsel for the Association of Counties. And we have been putting these webinars together by region and by county by region, because that seems to be the easiest way to cover everyone with the least amount of duplication. And I understand that that means that for a number of legislators, you may have duplication, and it was just something we couldn't figure out how to not make that happen. So I apologize, but please feel free to listen to our call tomorrow, as well as we are recording all of these. We are providing notes from all of them, and when we have finished them all, we will roll all it up into one document outlining the things that we've heard thematically throughout the course of these webinars. I just want to call them calls. So we are going to spend about 20 minutes getting an overview of our current situation in this region, which for purposes of this call is Skamania, Yakima, Klickitat, Benton, and Franklin counties. And I think this will be an interesting one because I think we have a pretty diverse group of impacted counties, or in the ways that they're impacted. So it'll be interesting to hear the differences from everybody. But anyway, we'll start with a situational overview from Jason Zachariah, who is from the Benton Franklin Health District. And then we will move on to roughly 25 minutes, 5 minutes per county, to talk about their response to the pandemic and how that the impact that the response has had on county functions. You'll see a list of ideas, but they are certainly not universal, and there are things that are very specific to specific counties. So we'll look forward to hearing from them in that regard. Then we will turn to a second 25 minutes, again, roughly 5 minutes per county, to talk about looking ahead. What's keeping people up at night as we are dialing out of this current more restrictive phase? What needs to happen at the county level to make the next phase successful? Looking more beyond that, what kind of impact is this having to the local budgets? What does it mean going forward in terms of staffing and providing services and doing the things that you need to do for your constituents that are not just specific to the pandemic, but are being changed because of the pandemic? And then we will spend the remaining time, hopefully it'll be about 15-20 minutes, where we can just spend some time letting legislators and legislative staff first ask questions. And when we run out of questions from them, we can either adjourn early, or we'll use all the time, or we can spend some time talking about other questions that you all might have. With that, I think it is time to go ahead and get started. I want to turn the call over to Jamie Bodden. She's the Managing Director of the Association of Local Public Health Officials. She is staying extremely busy, and we know that the local public health officials are as well. So we only picked 1 per call because we did not want to overburden anyone any further than they are already burdened. So Jamie, take it away, and thanks everyone for being here.
Great. Thanks, Melanie. Much appreciated. For our legislators on the call, you'll remember back in January and February when session was in full swing, Secretary Weissman and I gave briefings to you all around COVID-19 and coronavirus. Kind of updating you on kind of the current situation. And as you can see, things have evolved. But I really want to stress that local public health has been on the front lines of this effort since January and have really put in a lot of work in making sure communities are safe and protected. Even back in January. And so I'm very, very proud to represent them in Olympia and just really proud of the work that they are doing and the long hours they are doing. It's my pleasure to introduce Jason Zachariah, the administrator for the Benton Franklin Health District. I know they are working very closely with both counties as well as communities in both their counties and in their region on a number of big issues. And I believe Jason has brought a few other staff members as well. I'm assuming probably Rick, Dr. Person, their health officer, and Carla as well to talk more a little bit about what they are doing. So with no further ado, Jason, I hand it over to you. And you might be on mute, Jason.
So
there we go.
This is actually Rick Dawson with the Benton Franklin Health District. Jason has taken a call out of the room, so I can go ahead and kind of get started with what we did, kind of where we started and where we're going and where we hope to go, with this response and with COVID-19. So kind of for everybody, we became aware of COVID-19 just like everybody else in January, started evaluating internally with our communicable disease program what we might need to be able to do and be ready for it if and when a case happened in the United States, which obviously very shortly thereafter that actually did happen. We prepared to track and quarantine originally travelers returning from affected areas across the globe and then monitoring those quarantined for a period of 14 days after they returned. We did a lot of learning, educating staff on signs and symptoms and preparing for that response. Early on in early February, our district here activated our emergency response system and entered into a low-level, consistent monitoring of what things were going on, activating our emergency response plans, sharing information with our medical community and partners through webinars, email notifications, conference calls, and then started in earnest kind of developing web information and links for our providers and for our public specifically to COVID-19. In this time, in between kind of January and March, our district spent about 300 staff hours doing those activities and spending those things, coordinate with our public health partners and being able to expand our response. Most of that was spent providing education with our medical providers about testing and what the limitations were and how they could get testing done through the state lab, which at that time was the only place that we could get testing done, and what the criteria were for actually doing that, and then kind of making sure that we maintained situational awareness for activities and cases as they occurred throughout the state and across the nation. So for BFHD, that seemed to be pretty much our activities, and we kept preparing as cases started appearing in Western Washington, preparing knowing that it was what I wouldn't say impending doom, but expecting that it was going to happen in Eastern Washington. So when we got to March, we were continuing monitoring travelers, shifting most of our activities to kind of returning cruise ship travelers that were coming back, and then continuing to share that information and updates from CDC and Department of Health with all of our partners. Cases in our region first appeared in mid-March. And instantly, at that time we were in full-blown ICS mode and incident response. And we began at that point case investigation kind of in earnest, doing contact tracing for our people, moving from BFHD from a normal 5-day-a-week operation to a 7-day-a-week operation, and taking our communicable disease investigation staff from 4 full-time staff members to 18 staff and volunteers doing daily work, so 7 days a week. We started working more diligently with our labs, working to expand testing capacity with that, and providers to understand and support testing within the community as it became necessary. We expanded at that time, our information team, from a PIO to a team of 5, putting out regular and consistent information both through the web, through our social media accounts, and then scheduling regular media briefings, at least that are going on, currently still going on at least once a week. And then holding regular meetings and briefings with our hospitals, our emergency management folks, physicians, and decision makers. After a few days of doing that, BFHD found that we were quite overwhelmed and actually requested an incident management team to come in and assist us with our operations, which they did that, and they came in and worked with us for 2 weeks to help stabilize our operations, to help us consistently work at assigning additional staff and scaling up our staff to be able to respond and improving those efficiencies so that we were training staff, volunteers to perform tasks that weren't in their normal duties. And at this point, we have had 83 of our 87 employees at Benton Franklin Health involved in this response, as well as trying to maintain some of those essential services like our WIC program, our vital records services, some of our environmental health services. We are a mid-sized health department with 15 environmental health specialists, and we currently have 3 working in environmental health, and the rest of them are doing other activities from contact tracing to leading long-term care response to doing some of our public information activities. And that is one of the things, as our first case actually showed up in adult living, we quickly worked with a team and assembled a team to actually help and assist our long-term care facilities, not only with infection control and case investigation, but also with helping them prepare and what kind of PPE that they actually needed. And then further from that, we worked with our medical providers, knowing that we were going to be stressed, and as this was unfolding across the state and the nation, that help from other regions was going to be minimal, and that Benton Franklin as a community needed to be able to withstand growth and possibly overwhelming our medical system. So we worked with our local medical systems within their plans and within our plans to develop a cohesive effort to manage surge in our medical system and get beyond and make sure that we were readily coordinated, and also working with our regional Eastern Washington or Ready Healthcare Coalition to make sure that we folded in their activities as well. And then most recently, we've been working to establish with Department of Social and Health Services, request through FEMA funds, to establish some isolation and quarantine facilities or step-downs for long-term care where they no longer need to be in the hospital, but they need some place to care, and we've actually been pretty successful with DSHS to at least get an isolation facility set up so that we have a place to decompress some of our hospitals with long-term care patients. Spent some time working with our emergency management partners to help and assist and get funding for isolation and quarantine facilities for our medical providers and our EMS workers. So if they are exposed and don't wish to go home to isolate, that we have facilities available for them. Coordinating PPE needs throughout our community, both through working with the Healthcare Coalition, WISHA, and then working with our emergency managers to get those things out. And currently, one of the changes that we've made as our incident management team left us about 4 weeks ago now is that we have now co-located our emergency response functions with Benton and Franklin County Emergency Management so that we have a very, very coordinated effort in helping our communication, as well as decompressing the health district's need for space as we continue to expand the operational activities here in our normal building. Other things we're doing is working at coordinating with our regional LHJs. We know that this virus doesn't stop at county borders. We have lots of employers who have employees from multiple counties and are currently working, with DOH and our adjacent counties to deal with a pretty large-scale outbreak in a processing facility. And just, basically working diligently to get some of those things done, but it is coordinating and making sure daily calls are happening with hospitals, weekly calls with our EMS, looking, daily at, what our load is, and then doing that contact tracing, which is probably the biggest thing that we're doing and will continue to do, is that we are getting anywhere from 12 to 40 new cases a day in our jurisdiction right now. It kind of fluctuates, but to date we've been able to investigate and do that contact tracing for all of those within about 24 hours, and hoping that we can continue to do that for the foreseeable future as we work to protect our community. And then, lastly, we're kind of continually evaluating what we're doing, whether that's contact tracing, whether that's working with our long-term care, or whether planning with our partners. We look at everything we do and how we can improve it, and making incremental changes as we go forward to be more efficient and more complete in what we do. And then, other things we are doing is trying to, keep people informed. We have a weekly call with our local decision makers, which includes our hospital CEOs, our elected leaders, both county and city, some of our representatives, the governor's office, and giving a weekly update to where the health district is, what needs we have, and working, across the system as best we can to make this coordinated response. And then, going forward, we're kind of in the process of planning for the easing of restrictions, what those mean to us for staffing needs, protective actions that'll be necessary for all of our citizens, and then kind of assessing our community readiness for testing and rapid response. And in that text, we're working with some of our industrial leaders, Industrial Development Council, and Pacific Northwest National Labs to try and see if we can find ways to work as a community to help our citizens be well prepared. I think that's my spiel for today. If everybody has questions, I'd be more than happy, or any of the three of us will be able to answer them.
Thank you, Rick. Before we move on, I do have one little question that I'm hoping that you could speak a little bit more to. Megan from Walla Walla presented in her region, and she mentioned Tyson, and you mentioned food packaging just briefly. And I know that your district has been involved with that too. And additionally, we have a number of jurisdictions that are ramping up agricultural efforts and having a big workforce of agricultural staff coming into their districts. Just hoping that you could touch on those things too, and just kind of talk about what you've done, what you're looking ahead to, what kind of your plans are, if you could just speak to that.
So early on, we tried as best we could to reach out to our farm worker housing that we had contact information and provided, that guidance. We've been working with the Department of Health as they work toward emergency rules towards farm worker housing. We are also, we talk about Tyson and those. We do regular reporting through our system to look for commonalities that will tell us we may have something going on, including Tyson and other workplaces that might lead us to say, hey, we need to reach out and reach out quickly. And we do that through, regular reports that we run through our data management system that help us determine those things. And we've spent a considerable amount of time working with Tyson, working with Walla Walla Department of Community Health and Department of Health in working toward, resolution and assisting the citizens that live within Benton and Franklin counties that are affected by and associated with that workplace that are currently infected with COVID-19. knowing that, you know, also as we look at that, that is one of those places that over 1,000 tests were run Friday and Monday at that facility. And as we expect, we will expect that we will have a surge in cases associated with that, because it is consistently clear that 90% of their workforce lives within Benton and Franklin counties and not Walla Walla. So we are stepped up and ready to deal with that surge, but knowing that it's going to have an impact on our community for a consistently long period of time, because while they work at Tyson, they actually live in our community, and exposures happen in other places than the workplace.
This is Amy Person. You know, the one other thing I wanted to add about that, looking at Tyson and both some of the things around agriculture, is I think this is another area where, you know, when we think about approaching things, it's not going to just be locally, but we need to think a little bit regionally, because we have people, you know, that live in multiple jurisdictions, but, you know, may work in a single one. So, you know, ensuring that there is consistency with how it's being addressed, I think is important. And I think it's something that, you know, the COVID-19 thing sort of just kind of slammed us in the face with, that we do need to think about how we are reaching across our county borders.
Great. And Dr. Person, good to hear from you. Any final thoughts? I just want to thank you all for all of the really, really hard work that you're doing. I know you've put in a lot of really long hours, and Rick, you even mentioned, you know, it's not a 5-day operation anymore, it's a 7-day, and I would wager it's probably a 24/7 day operation that you are all doing. And so just really thank you for the work that you're doing, and just so grateful to have you leading the way in Benton Franklin.
So in kind of closing comments, I mean, if we can see on the screen, there's FPH and ongoing infrastructure needs. And, you know, we are a relatively, like to think of ourselves as a pretty sound health district, but we are stretched right now beyond, at times, our capacity, not necessarily in numbers of workforce, but in training of workforce to do some of those foundational public health items, which, you know, disease investigation is difficult, and we are struggling having enough, you know, we can train people to ask questions, but we can't necessarily train people quickly to understand the why of what we're doing and disease processes as well as we would like to. So having more people readily on staff to lead some of this response would be highly beneficial to us, and it is one of those places where we feel certainly lacking in public health as we lead this response.
Yes, FPHS, ongoing need. And I know our legislature is well familiar with that work. Thank you for that plug. I appreciate it. Thanks again. Really, really appreciate it. I'll just put in a plug. If you do have questions that you want us to start kind of putting in the queue for the end, make sure you type them into the chat box. And with that, I'm going to turn it back over to Melanie.
Thanks, Jamie, and thanks to everyone from Benton Franklin for everything that you've been doing. I think it's important for people to really understand how hard the work is and how overtaxed you are. So thank you for taking the time, having just talked about how busy you are, to do this with us. We really do appreciate it. We'll now spend the next 20-25 minutes or so talking with the counties to find out how they've responded to the pandemic and how that response has affected their functions. And I think I said this earlier, that there's some examples on the screen, but they're not necessarily specific to each location. So I would certainly hope that you will bring up things that you've had to do in your county that maybe aren't things that we would have thought of, or you know, are things. There's certainly themes that are coming forward in terms of worry about, budget looking forward, but also if you have comments on just the cost of dealing with the pandemic and the myriad ways it's affected county services, that would be great. So let's go ahead and get started. I accidentally got these in alphabetical order today, so we'll go with Benton County first.
Hi, this is Jerome Delvin. Commissioner, can you hear me all?
Yes, thank you.
Okay, so real quickly, when the governor declared the order, we put all of our employees on administrative leave, paid administrative leave, except for essential people we thought were essential. So certainly correctional staff, the sheriff's department, our public works kept working, and then some other staff. The courts chose to go down to a limited work schedule Monday through Friday, but are still open for limited hearings and such. Our jail, our correctional facility, our jail commander, our chief, he immediately put a hold on all contract prisoners, and then when the mini chain and the state stopped there, we started reducing population in the jail because we had a lot of contract prisoners. I think we're down to like 39 U.S. Marshals or 36 U.S. Marshal prisoners, about all the contract prisoners we have left. We haven't had any outbreaks in the jail. They put a very strict protocol. Everyone gets their temperature taken. If it's high, they don't come to work. A lot of cleaning being done. So far, nothing in the jail. We still have about 250 to 260 prisoners a day in the jail. Now we're kind of wondering, with the CARE Act that came out, we asked our employees to use up that 2 weeks emergency leaves if they could, encourage them to. And then now we're trying to figure out if we can use, I think we can use some of that federal money that came through to pay for some of that. We're in the process of deciding what the money that we're going to spend on what and how. I know one city already locally has come out with a grant program to their businesses, a limited amount in their jurisdiction for their businesses. So we're looking at those things, how we can help the health department out with some of those funds too. Out of the, I think Benton County's getting, I think, $11 million. And the cities are getting, of course, their share too. Public safety, let's go to budget and finances. So we're watching that. Our February was down 8%. Our property tax was pretty close to what we took in last year at the same first half of the year. So that revenue, we're not so concerned about that. It's going to be the retail sales tax. See how that for March, of course, we don't get that till May, but that's what we're kind of watching. So far, our budget is doing pretty well. I mean, a loss in the jail with the loss of revenue from the contract prisoner is certainly, but we understand some of that cost can be shared because of the things we had to do on the jail, that maybe we can cover some of that with this money that we receive from the Fed. So I can't think of anything else right now. We don't do solid waste. We don't do broadband. We have set up some quarantine hotels through our human services. I know the food banks are doing food. In fact, we opened our parking lot at the fairgrounds so they could hand out food because there was quite a turnout the last time they did, and it caused a lot of traffic problems. So that's all I have, Melanie.
That's certainly plenty. Thank you. We really appreciate it. Anybody else from Benton before we move on? Okay, since I just see that he put something in his mouth, I wanted to put Eric on the spot because we have a question from Representative Paulette, and Eric probably has the most up-to-date information. I'm not even sure if all of you know about the CARE Act distributions that were announced. So I thought I'd give Eric a minute to talk about that, and then all of you, as you're answering the questions as we work through this, if you want to work this into your answers, I think that would be terrific. Sorry, Eric.
Great, thanks, Melanie. Yes, so the governor's office did announce the release of $297 million for counties and cities under 500,000 people. If you hear a train go by behind me. So we are, in fact, have forwarded on the information from the governor's office associated with what each county should expect from that 297 million. I would remind folks that we hope this is just the first of two or more releases of funds. The state received about $1.3 billion to go, that could go to local governments. The first 785 million were already appropriated by the federal government to counties and cities over 500,000. That left about $542 million for cities and counties under 500,000. The governor's office released $297 million. There is a set of criteria for what is eligible for these funds to be utilized for. We have sent that information out to commissioners, county administrators, budget folks. We anticipate, hopefully, that those resources will be made available within the next several weeks. They'll come from the Department of Commerce. The last I had heard, the state had not made their determination yet whether or not they would simply do a transfer of that amount to each county, or whether it would be on a reimbursable basis back to the Department of Commerce on a monthly basis or quarterly basis. These are funds that you would have incurred and not budgeted for between March 1st of this year and December of 2020. The one element that is clearly not eligible is you cannot utilize this as simply replacement for lost revenue. It is meant to be for expenditures that you're going to incur in response for COVID-19, including public health, emergency services, things that you might have had to do in your jail to make sure that you can continue to have public safety. And certainly there is an element, I think, which is what is noted, I think, in Representative Paulette's question. You can utilize it to support some of your small business community. So with that, I will stop there, see if anyone has any questions, and hopefully folks can add into it as they're speaking about what they're thinking about utilizing these resources for, if they've even began to get that far down.
Thanks, Eric, very much. And Jennifer Wallace, who is the Executive Director of Waco, just typed into the chat box that Scott Merriman at OFM said yesterday that the funds would be done by reimbursement. We knew that they were speaking with Commerce yesterday, but we had not followed up to find out what, if any, decision that they had made. So that's new information. Thank you, Jennifer. And it may, on a reimbursement basis, impact how people decide to use the funds and how long it takes to get reimbursement. So that could potentially impact decision making. So thanks, Jennifer, appreciate knowing it. Why don't we go now to Franklin County, and please feel free to address the CARES question as well as the impact on county functions. Have anyone from Franklin County? I know I had people from Franklin County on my list, so if anyone is speaking, you must be muted. I can't hear anyone. Okay, why don't we go ahead and skip Franklin then, and if anyone comes on, we will move back to them, but let's go down to Klickitat for now.
Can you hear me?
Yes.
Okay. I don't know if Dave Sauter's on the line or not. He'd actually be able to speak more to what the actual process has been since the virus hit. I can speak towards solid waste, and I know that our response when it first came through was pretty swift, and we're still shut down to the public. We're still doing things, in a more aesthetic way. So we are not working in our offices. For those of us that can work from home, we're working from home. For those of us that can't work, of course, are not working. And, you know, it looks like we've had a really good slowdown of the virus at this point in time. I think we've been at 16 to 3, 3 that have passed for the last week and a half now. So, so I think things are going pretty good on that part. I know that our emergency response has been pretty good. But like I said, my commissioner would be able to speak better to that because he's got more intimate knowledge of what's going on in the county than I do in terms of the emergency response. For solid waste, we haven't had too many changes here. Transfer station is try to change hours a little bit. They have had to lay off some workers up there at the landfill just because there isn't a whole lot of garbage coming in, at least commercially. I mean, people are still out there and they're still creating garbage, so transfer stations are still being manned. They're just doing it in a more careful manner. So they're doing the 6-foot distancing, and I think they're using a lot of sanitation in terms of money changes hands. But like I said, for pretty much everything else, I think Dave Sauter would have a little bit more intimate knowledge. So if he's on here, it would be nice to have him back up some of the other stuff that I'm not too familiar with.
Well, we did have him signed up on the list. Commissioner, are you with us?
So I'm going to assume that maybe he's not on. I would certainly like to herald out the question of the small businesses and, of course, you know, the problems with rent, with the housing. I'd like to see how we're going to shake that up, how that's all going to shake out. I know for us here in Goldendale and for White Salmon Bingen, we have a lot of small businesses, and I think this has really put a big dent in, and of course, their operations. And with them being small mom and pops, it's going to be real interesting to see how many of them are actually able to come back.
Great, thank you. And if he joins us, we will we'll come back to him just in case, along with Franklin County. How about we move then to Skamania County? I have a lot of Skamania people on my list, so hopefully some of them are actually on. If there's someone from Skamania speaking, we can't hear you, you'll need to unmute.
Yeah, I know there's people from Skamania on the chat list anyway, so attendance list, so.
Okay, well, if we have anyone from Skamania and you're having trouble speaking, please let us know in the chat box and we'll try to get that figured out. I hate to miss anyone. And like I said, we had a handful of people sign up, so I'm hoping there's at least one on the line. In the meantime, let's skip down to Yakima and then we'll come back.
Can you hear me?
Yes.
Okay. So I'm happy to provide a day in the life of a 5-month commissioner who's just learning her job in the middle of COVID. It's just been kind of crazy. I serve on the health district board, as do all the commissioners, I'm sure. And so we've been working closely and communicating closely with them, getting a lot of the same kind of information that you just heard this morning about trying to be proactive. I think in our county specifically, we are a ag county, lots of food, we're the breadbasket. So we have been trying to be proactive with the packing warehouses and the ag workers to have more tests available. So we've been, I think, have higher numbers here, but it's also because I think we're doing more testing here. We have about 35 cases a day as per the district this morning in our board meeting. And I think that, I don't know what our curve looks like. I think we might be a little bit higher than other places, but I know that they're right on top of it and working hard to control that curve. Other things happening, you know, we are doing the day-to-day operations here. We don't have everybody here at the courthouse. We have, I think it's 30% of our folks either working at home or non-essential. And I'm personally getting a lot of phone calls from local businesses about this. I think there's some communication confusion about, you know, nobody's been through a public health emergency before. People don't really know what they're supposed to be doing, and they're appealing to commissioners to be able to have some power in this situation and help them. And you know, I've been trying to do that just by collecting some business plans and trying to help them understand, you know, maybe a safe pathway. But I also explain that this is not my jurisdiction and I don't have control over that. So it's kind of a, you know, I'm getting a lot of daily communication, but trying to be helpful and supportive. Let's see, we also have an isolation and quarantine plan here in the county, working with the Commerce Grant, which was very much appreciated here. Coordinating with the local health district, emergency management, the cities, our human services department, and the local homeless providers. We're working on situational, you know, quarantine facilities, hotel motel vouchers, supportive healthcare plans. We had a positive case among our homeless community that was a borderline mental health situation as well, but not enough to be ITA'd. So it was kind of a challenging case, someone who didn't want to quarantine. So we worked through that Friday and over the weekend and came up with solutions. We had to really mobilize quickly to try to solve that, but we've got it figured out now. I would say that food supply is probably the biggest concern that I would have. And those of you who don't know me, I own a grocery store too. So I'm on the front line in my other life. And so I saw the public panic over TP, which was pretty ridiculous. But I am concerned, genuinely concerned about messaging right now and making sure that we don't create a second panic over the meat and produce and things like that because of you know, concerns that packing plants are closed or you know, those kind of things. I think we have to get ahead of so that we don't have the public go out and just clear out all the stores again. And you can't, and those things, the supply chain is very challenging as well, as I'm sure you know. Working here, trying to provide sanitation and PPE for all the nonprofits in our county. We put together a website here called Yakima County Needs, or Yakima Valley Needs, I think it is. And it consolidates all of the nonprofits and needs, and we went out and did some bulk buying for them of all the essential stuff that they would need for not just the homeless providers, but also food banks and so forth. So that's been a good thing. Let's see. We're partnering with the growers, the Farm Bureau, L&I, Department of Health, all talking about the farm worker housing and our ag business and trying to educate employers here so that they have safe practices to remain open. And that is something the health district is being very proactive on. And I would say, I echo the concerns of the other commissioner about the corrections. We are a large corrections department. We have usually 950 inmates. We started 3 weeks before the stay-at-home order with taking temperatures and extreme sanitation and really being careful in there. And we haven't had a case, and to the credit of our team, who's been doing an amazing job. But we also support the rest of the state, the small cities, the federal and state contract beds. And that is a huge financial impact for us. So I think that is all for me. Oh no, the courts. I didn't mention the courts. The courts, we're in a courthouse. The courts are in the courthouse. So there's essential services in here that are closed to the public, but the courts are semi-open. So we have, they're dealing with domestic violence cases and court, child custody, things like that. But we have about 1,000 case backlog that we're going to be facing when we reopen. So I think that was the last thing I wanted to share. Thank you.
Commissioner,
Thank you.
Eric, yes, just say, Commissioner, this is Eric Johnson. This may be a question under budget and finances for potentially Craig Werner, who I think is on the line. I saw put Craig on the spot, who's the longtime budget manager in Yakima County. I was just going to ask Craig about kind of talk a little bit about the revenue flexibility, the silos of money that come in that sometimes limit our ability to kind of prioritize, and particularly when we have budget crises, how do we gain some flexibility in revenue? So I don't know, Craig, if you are unmuted or if you could say something real quick about that.
Yeah, thanks, Eric. I think one of the challenges is, like you said, we get a lot of money in. In fact, as I go through and talk with Commissioner Baker as we're working with her to understand government, which she's, by the way, a great, a fast study, you know, it's really difficult to look at the general fund and then look at all those other funds of siloed money that is all sitting there. And that is money that is dedicated basically for very specific purposes. And any flexibility in those revenue streams that we can have is much appreciated. You know, because we're not only just going to face cash flow potential situations, it's also going to be the, you know, ultimately the revenue to be able to cover this. And Commissioner Baker mentioned for us, one of our big issues is going to be our jail. Right now, in terms of our revenue stream, we're losing about $500,000 a month in just revenue bed contracts, and that's going to be significant. That's our general fund. But having the flexibility with real estate excise tax, hotel, motel, we know that one is being pretty well decimated, but any other types of revenue streams that we could possibly use, that would be great.
Great, thanks, Craig.
And Commissioner Baker, you anticipated one of my questions, which was something we've heard on other calls about the backlog the courts will be facing. So thanks for getting that one in at the end. And it looks like we do have Commissioner Hamlin. So if that is in fact true, why don't we go back to Skamania and give them a chance?
Okay, can you hear me now?
Yes, we can. Thank you.
Okay, so the good news is that we got notice yesterday that the district courts are operating. They are still not open to the public, but they're processing a lot of the court fines that they have occurred over the last few weeks. So they're actually operational. The other good news is that we're doing pretty good on our projections for our trust lands, and that will also help our budget. The bad news is our budget, and the shortfalls we're seeing there are going to be from sales tax. Skamania Lodge is closed, and all of you know how important Skamania Lodge is to us here in our economy. The other area that we've seen some problems within departments is in seniors, and that is the result of ridership being down and being reimbursable grants for ridership. And so seniors is one department that we've had a real problem with. One area that serves both Klickitat and Skamania County is the Washington Gorge Action Programs. They run the food bank. They've seen higher demand, but they've also had higher donation levels and more funding coming through. So it's, I hate to say it's balancing out, but it is. It's working in both directions, good and bad. That's pretty much all I can think of right now.
Thank you, Commissioner. And I understand that we have had others trying. So if anyone else from Skamania would like to speak, we can go ahead and let that happen. Otherwise, we'll move back and start talking about future. And please, if anyone, I am still not thinking we have anyone from Franklin County, but let me double check before we move on. Okay, so let's go back up the line then, and why don't we go ahead and start with Yakima, if you would please, Commissioner. Talk about looking ahead and what your county is going to need to be doing as we move into our new normal, what things scare you, keeping you up at night, etc.
Okay, I have got some notes on that. It's interesting thinking about what we need to be doing in Yakima County. needed to move into the 21st century a little bit. So some of the things we're having to figure out is how to do things online. And we're definitely challenged in that way. And we're looking at drive-up services and things like that as well, just trying to make it so that we can be a little bit better with public service during a time like this. I'd say some of I think we mentioned the budget concerns, the revenue replacement, the tax collection issues. I think what's scaring me is the food supply situation. I'm concerned about that, making sure we stay ahead of that. And that's kind of a health district concern here. I'm concerned about small businesses. I'm a small business owner. I'm talking to them. I would really like to help them find a path and have some hope to get reopened. I'm hoping that kind of comes together soon so that they can, you know, I don't want them to lose hope. We're going to have a protest here on Friday at the courthouse, people demanding a reopening. And I think some of that is, again, the communication on jurisdictions and who can do what. And I think we will do our best here to communicate that. I am concerned about, anyway, the small businesses closing. I think the PPP funding is the second round, hopefully going to come through and help some of our local small businesses. But with our CARES Act, I mean, I would love to be able to help our local small businesses. We have Yakima County Development Association here who processed our commerce grant that was $187,000. And with that money, we had over 700 applicants. And it was a $10,000 grant. So obviously we didn't help nearly the number of people that applied. And so, you know, we haven't had discussions because we're just now figuring out what the funding looks like and what we need to use it for. But that's a place that's a real possibility. And the rental assistance, you know, I've been examining that anyway, trying to figure out how to help folks. We already have rental assistance money, but there's been some confusion about that because typically you have to be at threat of eviction in order to get rental assistance. And here we are in a situation where there's a moratorium on eviction. So technically, you know, we can't provide the assistance. And so we're working through that, and hopefully we're going to be able to provide some assistance and look at the standards of who we can serve. You know, normally we would help people, you know, down in like the 30% AMI type, you know, or whatever the number is. I don't have it in front of me, but you know, this is going to impact a wider variety of renters, people who probably made more than that before. And so I'm happy to look at that as well. And our public health system and our, if they need our help, I think the contact investigation is a real thing here. I know that the staffing and concerns about being able to do that are real. We had an opportunity to possibly have some students out of San Francisco, the University of San Francisco of all places, offer to help us with some of that. We're looking for, you know, people to help. We have a lot of cases. We need to do a lot of investigating to figure those clusters out. And let's see, what else keeps me up at night is like the vision of empty buildings and closed small businesses. I really will do everything in my power, and legislators, if I can help you, partner with you, I am here. Just give me a call. Thank you for everything you're doing.
Thank you very much, Commissioner. And so now let's move back to Skamania County. If we have anyone with a working microphone, I will tell you that we did get a message into the chat box from one of our commissioners who says, we started conversations yesterday with the health department, sheriff, and others on how to open up based on the governor's last news conference. We are a tourist economy, and as we open up state lands, fishing, golfing, etc., we will have people from outside the county want to use our county. We are trying to be wise and considerate of every aspect we can think of. Thank you. You have anyone else who has a working microphone for Skamania, or should we skip for a minute and come back? Okay, let's move to Klickitat County. Do we have anyone from Klickitat who wants to weigh in?
I've already weighed in. So Dave Sauter.
Like to add on looking forward?
Looking forward, I think we have a meeting on Tuesday next week to discuss the steps that we're going to be taking to kind of come back online, to do it, you know, slowly and responsibly. It's really difficult to anticipate what the new normal is really going to be like. I'm pretty sure that, you know, we're going to be using a lot of face masks and a lot of whiskey or sanitizer. You know, I don't think business is going to be normal anymore. I think it's going to change, and I don't really think that we're going to see the majority of the impacts, at least for, I don't know, at least for us, another month or so down the road. Like we can see it in the towns, but in terms of our revenue, you know, it's going to get hit kind of hard. So we'll see where we're at when this all shakes out. And like I said, Dave Sauter, if he were here, he could help us kind of understand a little bit more of an intimate knowledge of what's going on here in Klickitat County. But it seems he's doing something else. I don't know. You know, I don't really have a lot of fear looking ahead. I think it's all going to shake out the way it's going to shake out, and we're going to address it when it happens or when it doesn't happen. My thing is that I'm thinking that come fall time again, we're going to be kind of right back where we started, and if we don't have a really clear, succinct plan by then, I'm not really quite sure how this economy is going to do with another shutdown. So I fear more for my family than I do for myself at this point.
You are probably not alone in that. And I should tell you, and I should have said this earlier, I apologize, you just show up as a phone number on our screen. So if you would like to introduce yourself, that would be lovely.
Oh, I'm sorry. My name is Ruby Irving. I'm the Klickitat County Solid Waste Director. So I actually came to like listen and to find out what's going on in other counties, because I want to be a little bit more educated on what's really happening in my state. And then when I seen Dave, my commissioner's name up there, I was like, sweet, somebody can talk to this, but I'm cool. You know, this works for me. I'll give you what I got, but you guys are giving me more than what I'm giving you, so I'm glad I'm here.
Thank you so much for pinch hitting. We really do appreciate it. And I don't know what happened. We certainly, as part of our COVID-19 learning experience, it's learning the new technology, and we have not had a call where something has gone 100% correctly. So there's no telling. So, but we really appreciate.
Exactly, it's a learning curve.
Exactly. We're going to be really good at this here eventually. So. Yeah. Do we have anyone then, let's see, from Skamania or Franklin who would like to speak? Okay, well, Commissioner Delvin, I'm hoping you're still there for Benton County, and you can close out this question for us. Thank you, sir.
Well, I'm sorry.
I was just hoping you could talk to us from Benton County's perspective on anticipated needs moving forward, that kind of thing.
Sorry, I was watching TikTok.
No worries.
But listening too, I'm a multitasker as a police officer. I can do a lot of things. You know, it's the anticipation on, like you say, financially we're doing okay right now, but you know, if April, you know, is the full month, and I mean, you can look around all the businesses that are closed. I mean, it's probably going to affect the cities more. I mean, our retail sales tax goes a lot out to the Hanford area, and as far as I know, they're paying their sales tax on what they're doing out there. I mean, they've had limited work going on out there, so that could be an effect for us. But the stores, you know, so that's the worry thing is if this continues. I mean, around here, I think people are getting to the end of the rope here a lot. Every morning, my wife and I go out and hike a trail up what they call Candy Mountain. It's like a 4-mile loop, but you know, there's a lot more people out there today than there has been, which is either they're getting tired of it, or they're finally, or maybe they heard we never closed the trails, but maybe they thought they had been closed. But you see a lot of cars out now this week than I have seen in the past. So I know there's a protest going to happen Friday at the county seat. So I think, you know, we're getting a lot of pressure. We need to do something, but really with our authority, limited authority, and try to explain that to people that, staff tried to look at, we couldn't think of one business that in the county outside the city limits incorporated that isn't open, because they're small grocery stores and agriculture. So, you know, it's getting frustrating for a lot of people. It's certainly, I understand their frustration, because as we're getting frustrated. So, you know, hopefully the governor today has some new information that he's slowly going to start opening things. But I think we're at the point where we need to do something, because I think he's going to lose control of the population here within the week or 2 weeks if something doesn't happen. I think people are that fed up from what I'm hearing and seeing that they're just going to start ignoring things. And then what do you do at that point?
And I echo that too in Yakima. I just want you to know I'm hearing the same thing. People are kind of at the end of their rope, and a lot of folks are just getting openly defiant. And so when I talk to them, I think the concern, and this is a communication thing, the concern is there's essential businesses, and that's sort of a nebulous thing. And then there's safe businesses. And so what I'm trying to do is anybody who's out there in the community who can operate safely, they're reaching out to me, and they have actual plans. They're willing. I mean, these folks are willing to do just about anything to be able to open. A hairdresser provided me with a plan that I think was better than the last surgery that I had. I mean, just to get their hair shop open. That's how desperate they are, and you can hear it in their voices. So if we could have a shift in approach from essential to safe, you know, there are some businesses that fall through the cracks and are safe. They're just not considered essential because they aren't a food or something else. So that's just a perspective I've got here.
Well, and we did also have Skamania County weigh in the chat box, hearing the same thing. People are not agreeing with the designation of what's essential versus non-essential. So another trending theme we're picking up in the last week, if not longer. So thank you. Well, unless we've missed anyone, which is sort of an open question at this point. Commissioner Lannon, did I see you? Are you new on the line?
Well, I've been here, but I just was able to get speakers and microphones working. So
perfect. Would you like to weigh in then, please? If you, you'd like to, you're welcome to.
And again, just to echo what others have said, I want to thank WASAC and the time that you take to bring this together, because this is incredible. So much of this is new to so many of us. Being able to share these perspectives and the situations that we've been in is incredibly beneficial to us. And for Skamania County, one of the things I do want to mention is we talk about the tourism economy, and we have very, very small amount of commercial activity. Mainly it's going to be the gas stations, fair number of restaurants, and a few local stores. So when we are inundated, as we've been on the last few weekends, with people coming out of the urban areas of Portland and Vancouver, that puts a real strain on it. We hear a lot of pushback from our citizens about people coming out and just kind of being disrespectful of what trails are closed and what they can and cannot do. That's one. Another one is, while we do benefit from tourism, 25% of our current expense budget comes from resource-based material, and a huge amount of that is related to timber. So we're very fortunate that the DNR has given us a little more hope for what we can expect in the next year or two relative to the trust funds there. And I think in going forward for us, as I think the commissioner from Yakima mentioned, we have to get into the 20th century because we've been behind the curve in terms of a lot of our equipment programs, training, and those types of things. And that's going to take extra funds. So it's interesting that I think we're going to get $663,000, and we need to make sure that we put that to really good use, because what concerns me about the future is we don't know if this thing is going to return or what the next impact is going to be. We're used to fires, ice storms, and snowstorms, which are usually short term. You deal with them quickly and move on. This is kind of like wading through quicksand. So again, thanks for taking time to listen to us.
Well, thank you. I'm glad that you were able to finally join us. We appreciate it. And one thing that I haven't heard mentioned on this call that I've heard on other calls is impact on gas tax revenue. And I'm wondering if any of you are thinking about that and what that might mean looking ahead to impacting your county roads and things like that.
Melanie, this is Tom again. We just talked with our public works director and reached out to some folks in the petroleum industry. Right now, pretty much across the board, gasoline sales are about 50% of what they had been. So if this continues for a 3-month period, we're just using that as a potential impact. Take 50% loss for 3 months. So just that's one of the things that we found. Thank you. And
Commissioner Baker, you were nodding your head as well. Would you like to say something?
Well, yeah, I think Craig probably could give you some real specific details on it, but we've had that discussion about county roads, and we have a big project pending, our east-west corridor, which, we want to make sure moves forward, and we have a lot of, obviously, a huge county to maintain, and that is a concern for sure. Craig, I don't know if you're able to weigh in with some detail, if you're still here.
Yeah, I don't know that I can give you much detail, but we do know that the fuel tax will be significantly reduced, and we are concerned about the projects. That plus, the road funds seem to be sometimes where counties go when they have needs, either through a levy shift or, I know in Yakima County, we pay for 4 road deputies to help support the road safety. So that's all stuff that's a big concern when it comes to the road funds and the loss of the sales tax or that fuel tax.
Thanks, appreciate it. And Representative Paulette is on the line. For those of you who may not be aware, he is the chair of the House Local Government Committee, and he, like Senator Rolfes, the chair of the Senate Ways and Means Committee, have managed to listen into several of these calls, which we are very appreciative of. And he has typed something into the chat box that I want to make sure you all hear. So I'm going to go ahead and read it to you. He says, maybe explain that it doesn't matter if 9 out of 10 businesses in an industry could be safe, since we are far from having the ability to test and contact trace at the level needed to reopen non-essential businesses. When hospitals lack PPE, how will a hairdresser justify having the PPE required to be close to numerous people in one day? Please share that question with your hairdresser and ask them to consider that nurses and doctors treating patients have been getting sick even with major precautions. When a sneeze can aerosol 15 feet and people can't eat in a restaurant with a mask on, how can there be a safe reopening when we don't have the testing and tracing capabilities needed? Definitely concerns I think we all share, and hopefully we will, we've heard relatively good news about testing capabilities and getting tests in and the capacities that our labs have. So that is looking promising, but I feel like, and I would ask somebody to correct me if I'm wrong, we haven't heard that kind of good news relative to the PPE. And So that I think remains an ongoing problem. And then the governor is planning on using the National Guard to stand up the contact tracing. And he plans to do that pretty quickly within the next couple of weeks, which given the number of people involved is going to be a pretty amazing task, I think. But so again, that feels like good news. It feels like going in the right direction, but I personally don't remember hearing anything good about the PPE yet. So hopefully I'm wrong and someone can correct me, but I think that's a great point, Representative. Thank you. Do we have any other questions? That was all we had in the chat box, but I want to make sure we have the opportunity for people to really engage and make sure anything they wanted to cover has been covered. Any questions you have want to be answered. If Eric or Jamie would like to weigh in with any closing words, I would welcome that as well.
Jamie might want to add in on the PPE. I know that yesterday that was a subject matter for the public health affiliate, or earlier this week, I can't remember, days are stringing together, but there's definitely some updated information coming out of both the Emergency Management Department of Health on PPE.
Sure, I can just touch base on that. I think PPE is going to be an ongoing issue. We've definitely been able to ramp up and get a lot of our big orders. I know we were at a state burning through about 1 million, pairs of gloves in a matter of days. So that's, I think, kind of the magnitude of what the PPE actually is that it's millions and millions, and we go through that in a really quick, short period of time. We also have a bottleneck right now with test kits and making sure that we have the testing supplies similar to our PPE, where we have mass quantities of those and they can be distributed in a very quick process. And so we've been able to, at the local level, provide feedback to Department of Health and Emergency Management on how that process can be expedited and more efficient. And I think in the next couple of weeks, as that massive rollout happens, I believe May 11th is the target date to get the case investigation expanded. I think we're going to see a lot of gains in the realm of PPE and testing. However, I think priority is always going to be given to hospitals, healthcare, and those that are conducting those tests before other non-medical areas for PPE.
Jamie, could you talk to the fact, though, that I know that private industry itself is also in the market to secure PPE so that they can conduct business. So how does that conflict with the work that the state's doing? Because I know that industry itself is very much in tune with getting PPE for their employees as they open up construction, for example.
Yeah, so that's a whole different pipeline and hasn't been part of the state EOC and Unified Command. State EOC has really been focused on the medical and healthcare side of things. So and this is me not knowing the intricacies of that, but I would say as more areas of supply open up for PPE, private entities would be able to purchase that. But again, if we're starting to see a shortage, what might happen is that the state, like they did early in March, really try to get as much PPE as possible and discourage, I don't want to say hoarding, but discourage mass purchasing of PPE for those that are not that level 1 criteria. Apart from that, I really don't know much more than that.
Jamie, I have a question for you, if you don't mind continuing to be put on the spot. I was just thinking about how busy you are and how often you're communicating with your local public health officials. And so I was wondering if you could just give us a little overview of how often your local public health officials are meeting with each other and exchanging information, and also how often and what the communications are like with the Department of Health. because it sounds like it's been a pretty good collaboration, but I'd love to hear from you a little bit more about that.
Sure, and I'm gonna share my hot seat with Rick and Jason and their crew if they're still on as well. You know, WSALFO convenes a weekly check-in call with all local health jurisdictions, and we really focus those calls on communication or process challenges that we're experiencing across the state, so that I can elevate those issues to my connections with the state EOC through Department of Health liaisons, and so that's been a really effective way for us to say, hey, are we all experiencing this issue? We are. Great. Let's elevate it. Let's get the issue resolved. And we've been doing that since, I don't know, maybe end of February. I don't, time has no meaning anymore, for a very long time, and that's been really helpful. We also, I know, have a number of little mini regional kind of check-ins that we have that our local health jurisdictions do with each other. So for example, I think Rick talked about, you know, connecting with Walla Walla and their folks around their multi-counties, just to see, you know, what issues are going, if there are issues that happen to go across borders, making sure things are aligned, sharing resources, that kind of thing. In addition, we have a number of weekly calls with the Department of Health, because this is a statewide, state, local public health and tribal public health response. We really need to be aligned on things. And so when there are big issues like case investigation and how we are defining cases and how we are testing and how we're facilitating all of that, Department of Health will convene those calls. We get the opportunity to provide feedback, input, and you know, really let them know what might or might not work at the local level. We have those calls at least once, usually 2 times, and even sometimes 3 times a week, depending on the issue and depending on what's going on. So I think there's a lot of behind the scenes work going on. I think the communication and the partnership with the Department of Health in particular has been great. That's not to say there hasn't been speed bumps, but I really think that the collaboration, the coordination has been good. And, you know, as we move forward to phase 2, I think that's just going to continue on. And I don't know if Jason or Rick or Amy, if you have anything else to say on that.
Jamie, this is Jason Zakaria from Benton Franklin Health District. I think you summarized it very, very well. Our communication across LHJs has been excellent. It's been excellent having our check-in calls that you referred to. It provides us an opportunity to collaborate, share information, share concerns, share wins, and so forth. So I think you did a great job. I don't really have a whole lot extra. Dr. Person does, though. Here she comes.
Yeah, no, I just wanted to add, because I'm also the health officer for Klickitat, and there's we have collaborative calls with public health in Oregon, and Klickitat, including also healthcare providers, so kind of some collaboration in the Gorge area as well, so not just within the state, but between states as well.
Great. Thank you all so much again for all the hard work you're doing and for taking the time to be here today. We have about 10 minutes left, so your options are we keep asking and answering questions for about 10 minutes, or go ahead and get to that lunch break that we've kept you from. So I will just sit here for a minute quietly and see if anybody wants to weigh in. It's so hard to tell with these if it's a technological problem or if that we really don't have anything going on, but I'm going to assume that we have no questions and just take the opportunity to, I don't think you can say it enough. Thank you to the public health officials, to the commissioners, to our council members, to our legislators, and all of the staff who have really put in a tremendous amount of time and effort in just really uncertain, unprecedented times. And there's just a level of stress that underlines everything because absolutely everything is new and everything is different. And we want to make sure legislators know that we are there for them, and we hope that they are likewise here for us, and that we can continue to work together on the same team as we move forward. We all have, I don't have constituents, I shouldn't say we, you all have the same constituents at heart, and you're all trying to help the same people. So the more we can do that together, the better, I think. And just thank you all again for all of your hard work, all of your time today. WASAC has been doing weekly phone webinar and webinars with all of our affiliates. So we've been talking with our solid waste managers, with our county engineers, with our planners, etc. So if anyone has a question about anything in that regard that we haven't had the opportunity to answer, you are welcome to weigh in with that. We also meet with the governor's office weekly. So if you have questions that you need answered, or anything you'd like us to pass on, please don't hesitate to reach out in that way as well. We're happy to take those messages forward and see if we can't get answers more quickly than communicating via email or letter. And we had one more comment I just wanted to say. The concern is that folks are doing things in their homes with no precautions, and that's a good point. I think people are kind of skirting the law, so to speak, using the term loosely by just changing how they're doing business. And but that you'll pass it on, it's excellent. So thank you for that, and thank you everyone. And with that, I will let you go about 7 minutes early. So thanks for your time. Bye-bye.